Health officials have recently confirmed that the mode of transmission of the COVID-19 virus has moved from cluster cases to community spread. The United States Center for Disease Control and Prevention defines community spread as a means where people have been infected with the virus in an area, including some of who are not sure how and where they became infected. Each health department determines community spread differently based on local conditions. Over the past months, there has been evidence to support the new mode of transmission, with a constant rise in cases. Consequently, the Ministry of Health has adjusted its protocols with regards to screening and testing persons who may have been exposed to COVID-19 carriers. Chief Medical Officer Dr. Shamdeo Prasad, during a recent virtual press conference, disclosed that persons who are exposed to someone who is positive for COVID-19 within a specific time frame can be tested before the onset of their symptoms.
And all persons who are in contact with a positive for at least 2 days before the occurrence of symptoms and at least for 15 minutes, that's direct physical contact. Persons who care for someone who has COVID without using the recommended PPEs are also screened and tested as needed.
Dr. Prasad further highlighted that suspected cases or persons awaiting their test results are required to home isolate for as much as 14 days. Once it is confirmed that persons are positive for the virus, then approval is given for them to remain another 13 days on home isolation. The criteria for home isolation states that patients should be monitored for the first 10 days by the Ministry of Health surveillance team. If within those 10 days they do not showcase any symptoms, they should be monitored for an additional 3 days before they can discontinue the process. Deputy Chief Medical Officer Dr. Karen Gordon-Boyle earlier this week had stated that the majority of persons on home isolation are asymptomatic carriers who do not require immediate hospital attention. As of September 8, 477 COVID-19 positive individuals were in home isolation. Also, 61% of the country's positives, which stood at 1,613, were health workers, 2 of which have died. Pointing to the severity of the cases in relation to deaths registered, Dr. Shamdeo highlighted that persons within the 30 to 49 age group have surpassed elderly persons over 70.
Interestingly, of recent, we've noted quite a few younger adults and persons in that age group, 30 to 39 to 49, that have passed away. And we had 2 less than 30 in their 20s. Most of the persons, about 70%, do indicate some underlying health condition like hypertension, diabetes, heart diseases, and some lung diseases, about 70%. But interestingly, we had quite a few persons, 15 in all, who did not actually have any underlying condition and just developed what are now termed acute respiratory distress syndrome.
Acute respiratory distress syndrome is a type of respiratory failure characterized by rapid onset of widespread inflammation in the lungs. Symptoms include shortness of breath, rapid breathing, and bluish skin coloration. Temika Rodney reporting for the HGP Nightly News.